So this is range of motion of the shoulder and the elbow. We need to know the difference between active, passive, resistive, and brake testing, but we also need to know the manual muscle test grade. So let's go through active range of motion, passive range of motion, resistive range of motion, and brake testing at the shoulder for flexion. Flexion is the easiest way to explain it. So flexion of the shoulder looks like this. So Aidan, all you're going to do is just go up and bring that arm up. That's obviously palm up flexion. You could also do palm down flexion. That's active range of motion, testing the muscle. Passive range of motion, I would tell Aidan to relax, and I would go ahead and do the same movement. That's testing more of the joint complex, the ligaments, right? Resistive range of motion would be exactly the same thing, but I would tell Aidan to go against my resistance of my hands. So go up, straight, keep going, boom. Into flexion against resistance. And then isometric brake testing is just like your myotone check, where you get them into the flex position, this is flexion of the shoulder, and you say to them, do not let me move you from there, don't let me move you, be strong. And that's your isometric brake testing, okay? So that would be for flexion of the shoulder. Let's say, for example, we were doing extension of the shoulder. I'm gonna have you turn face this way. Extension of the shoulder, obviously, is where the arm goes backwards, like this. So I want you to go ahead and do that, Aidan, and that would be active, okay? Relax for me. This would be passive, like so. And this would be resistive, so go against my arm for me, go, and hold it there, don't let me push you down, that would be brake. So for flexion of your shoulder, what we have is, the main muscles like biceps, coracobrachialis, a little bit of your anterior deltoid does flexion. Extension of your shoulder is like your lats and your teres major, those are the muscles. So if you get tested to do a muscle test, those would be how you do the muscle test. Now, grades of testing. So for grades of testing on the shoulder, we have 5 grades. Manual muscle testing are grades to check what grade of strain you have. So you have 1 to 3 grades of strain, and manual muscle testing are a 0 to 5 grade, which I'll post in the description, how you would assess if it's a strain or how bad the strain is. So for example, if there's a strain if we're concerned with the strain to the biceps does shoulder flexion and elbow flexion. So what I would do is grade 0 is where the muscle doesn't contract. So literally they cannot make a muscle here. They can't contract it. We would grade that 0. Grade 1 would be if they can contract the muscle without arm movement. So just give me a little bit of tension here. There you go, perfect. So we get a little bit of a muscle contraction. Grade 2 is with gravity. We can't really test the bicep with gravity, so we kind of skip grade 2. We go to grade 3. So now we do grade 3, which is active range of motion. Grade 3 is exactly the same as active range of motion. So again, you're going to go ahead and bring that palm up like that. Perfect. But because the biceps also does elbow flexion, I would ask them to go ahead and do a bicep curl for me. So curl up, perfect. And that would be grade 3. Grade 4 would be active resistive, or what we call resistive range of motion. So you would go resist and go up again. Go, push against my hand, good. Go back, now do elbow flexion. I'd stabilize here, and you go curl up into a bicep curl, good. Grade 5 would be the brake testing. So we could bring it up into that position. Do not let me push you down, perfect. And then we would go up into a bicep curl up, and do not let me push you out like that. Perfect. Those are your grades. I'm not going to show the manual muscle test grades on all the muscles, but that I'm showing you it on shoulder flexion and elbow flexion, and you need to adjust and do it for extension, etc. So what other range of motion do we have at the shoulder? So you're going to turn and face this way, and I'll have the camera come around. So we've got abduction too. So abduction is coming out to the side. That's active range of motion. Come back down. So your abductors of your shoulder, like your deltoid, your supraspinatus, and even your biceps. We also have adduction. Now, how you would test adduction is a little bit difficult. We would always try to do bilateral testing on all these tests. So on your practical, make sure if you're doing just one arm, you go ahead and do the other arm. But adduction is hard because we can only really start with sort of gravity-assisted testing, so they would come back down to their body like that. That would be like a grade 2, if you like. But then we would kind of go to grade 3, where I'd say, okay, bring the arm back down to the body, go, that's adduction. And then I would have them hold there and say, don't let me move you out there. And that would be adduction of the shoulder, right? So that would be your adductors, like your pec major, your coracobrachialis, and even your infraspinatus does a little bit of adduction. If we were going to do horizontal adduction is this motion. So I would say, actually we can do this with both arms, bring your arms out, go ahead and cross into horizontal adduction. Horizontal abduction would be going back out to this position, like that, so go back out, perfect. Other motions we have at the shoulder, which I like to test with the arms down by the side, is what we call internal and external rotation. So your internal rotators at your shoulder are I didn't even write it down. Your internal rotators at your shoulders are your subscapularis muscle. Teres major does a little bit of internal rotation as well. And your external rotators are the IT muscles, infraspinatus, teres minor, right? So if you're going to do internal rotation, or external rotation, I like to kind of stand at the side of the patient, take them out into the opposite position, and then I would say go ahead and bring that arm towards your body. That'd be some kind of like a grade 3 active range of motion. Then I would say, okay, now do a grade 4, go against my hand, boom, boom, boom. Good, hold it there, don't let me push you out, boom, and that's internal rotation. When I do external rotation, I'm gonna kind of flip the camera over here. I would go ahead and flip my body part. I would go ahead and say, bring your arm out, perfect, come back in, do a grade 4 against me, go, 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 and then hold it there, don't let me push it out. And then I would do the opposite arm. So that's external and internal rotation. External rotation is your infraspinatus and teres minor, and internal rotation is your subscapularis and teres major. There may be one or two others that you have to look into the book. The other one's elbow position. So we already did elbow flexion, which is like biceps and brachialis muscle and brachioradialis muscle, remembering that if you do your biceps, the palm should be supinated. If you do your brachioradialis muscle, the arm should be neutral. And if you do your brachioradialis muscle, neutral. And if you do your brachialis muscle, palm should be down, okay? So that's how you would change your testing. Extension, so go ahead and extend down, perfect. Now, if I did like resistive range of motion, go ahead and extend down against my hand. This is going to be tricep testing. Break test, don't let me move you up. Boom. Triceps and conius does extension, okay? The other motions we have at the elbow is pronation and supination. So what I want you to do now is go from supinate position, rotate to pronate position. Perfect. Those are your pronator muscles and maybe some of your flexors. And then if we were going to test resistance on that, I'd probably say grab my hand for me. So just like open your hand grab. And now keep your elbow beside you. Try to turn me over. Perfect. Those are your pronators. And then if we're going to test supination, I do exact opposite. So I'd say resist me as we go over. Boom. And that would be testing your supinator muscles into supination. So we have pronation. Go ahead, turn around. Active, supination. Boom. The last thing, we have you turn around to the board real quick. Face that way. And we have some scapular range of motion. Now, I don't think they're going to test you on it on the test, but we should know basics range of motion. So elevations would be like shrug your shoulders for me. Boom. That would be shrug and drop your shoulders back down. So that's elevation and depression. Retraction would be, okay, squeeze into my hands. Perfect. And protraction would be round your shoulders forward. So there, that would be protraction. We also have like upward rotation and downward rotation. The way you would assess that is with abduction of the arms. So bring your arms out to the side all the way to the top. And we would kind of assess up and go all the way to the top, all the way to the top. And we would assess as the scapula goes up, and then we would bring it back down into downward rotation. Hopefully, they don't test you resistive range of motion on the scapula, because that's really hard to do. But you should know there's elevation, depression, protraction and retraction, and downward rotation and upward rotation. I'm done.